The COVID-19 situation increasingly in Italy, where the death toll spiked to more than 6,000. As the toll surged in Italy, Prime Minister Giuseppe Conte said the national lockdown. The streets of major Italian cities were largely empty, as he has ordered people to stay at home. Italy's Interior Ministry said anyone flouting the lockdown risked at least 3 months in jail, or a €206 fine. Anyone who has COVID-19, and is caught breaking the obligatory 2-week quarantine order faces between 1 and 12 years in jail. Why Italy? Loads of people have been wondering why Italy has become the new epicenter of the coronavirus pandemic. According to channelnewsasia.com, experts list a few factors. This is only the theory. But other countries will want to examine each of these factors and address them through various preventive plans to avoid becoming the next Italy. Here, 3 theory why Italy become epicenter of COVID-19 pandemic. First, old nation. One of the first factors is Italians' average age. It is high. The median age of the overall population was 45.4 last year. Greater than anywhere else in Europe. It is also 7 years higher than the median age in China and slightly above of South Korea. The age of Italians dying of COVID-19 averaging out at 78.5. Almost 99% of them were also suffering from at least one pre-existing condition or ailment. According to Jennifer Dowd, professor of University of Oxford, COVID-19 fatalities are hitting older age groups hardly. Countries with older populations will need to take more aggressive protective measures to stay below the threshold of critical cases that outstrip health system capacities. But age is not the only factor. Second factor, the systemic collapse. The diseases start spreading much faster, but the healthcare system reaches its saturation point. Doctors have to start making life and death decisions about whom they help first, and why, when they run out of equipment such as respirators and even beds. As said by Paolo Terragnoli, the Brescia Hospital's emergency unit head. Sometimes you have to weigh the chances of success against the patient's condition. We try to do our best for everyone, while doing an extra something for those who have better chances. Lombardy, the northern Italian region around Milan, which is the worst affected by the coronavirus, remains in a critical situation. The reality learned across Italy's devastated north is that diseases start spreading much faster once the healthcare system reaches its saturation point. One of the Italian government's gravest fears is that the virus will start spreading to South Italy's area, which much poorer and far less equipped. The third factor, screening and counting. The world has suddenly realized that it does not have enough test kits to screen for COVID-19. Nations such as Italy dealt with this problem by only testing those who already exhibited symptoms such as a fever and a dry cough. South Korea had the kits and the means to conduct more than 10,000 tests a day. COVID-19 has forced lockdowns in more than 35 countries across the globe, disrupting lives, travel and businesses. These 3 factors is only research and theory. The best step, you just stay at home and follow the restricted movement order. Please, all of us must unite and pray for Malaysia healthy.